Oh, hello everyone. Hello everybody. I'm Dr. Chinyere A. Ugaji, MD, MBA, in the Electronic Residency Application Service 2015, updated licensing documentation, in current clinical practice and graduate medical education experience, a master's in public health, social and behavioral sciences at Capella University, Minneapolis, Minnesota, a public health, the American Mock Interview session 2015, a public health research on child abuse, sexual abuse, domestic violence as a public health continuum, a pediatric research with my 3-year-old son, Kingston Eke. Welcoming you to Dr. Chiquito Mentoring Iridescence Educational Global Collaborative Ustream YouTube show, a Reach Higher and Let's Move initiative of the First Lady of the United States of America, First Lady Michelle Obama. Today, the 5th of February 2015. It's approximately 7:10 a.m. Central Time. And I would like to invite you to read some famous quotes by the President of the United States of America, President Barack Obama, on the White House internship, and the First Lady Michelle Obama, on the Reach Higher and Let's Move initiative, and some excerpts from letters of recommendation from graduate medical educators on my Accreditation Council of Graduate Medical Education core competencies. I also want to apologize for the technical glitches that we've had so far, the technical auditory glitches that we've had, and so now we'll jump right into the show. We'll do the mini mental status examination, which is a fun activity that you could be called upon to do in your career or in your education. And Dr. Chiquito Mentoring Iridescence Educational Global Collaborative Ustream YouTube show and company has the capability to help you in that area. So the first question is what is your name? And my name is what is your name? And my name is Dr. Chinyere A. Ugaji, MD, MBA. Then the next one is what is your age? And I'm 33. And the next one is the patient allowed? And that's a yes for me. And then the next one is level of education, which is graduate school for me. Then what day of the week is it? Today is a Thursday. What is the year? This is 2015. What state are we in? That depends on where you are, which could be Washington, it could be Texas, it could be Illinois, it could be Africa. Please remember these 5 objects. I'll ask you what they are later. An apple, a pen, a tie, a house, a car. You have $100 and you go to the store and buy a dozen apples for $3 and a tricycle for $20. How much did you spend? Well, that's $23. How much do you have left? That's $77. Please name as many animals as you can in 1 minute. We are gonna name animals. I invite you to to contribute in this interactive activity. So we'll start with a lion, a dog, a cat, an iguana, an ostrich, a bird, a rat, a rabbit, an elephant, an ox, a goat, a chicken, a lizard, a monkey, a gorilla. So that's 15 plus animals. If you named 15 plus animals, you get the maximum score of 3. What were the 5 objects I asked you to remember? And they were an apple, a pen, a tie, a house, and a car. Then I'm going to give you a series of numbers and I would like you to give them to me backwards. For example, if I say 42, you would say 24. So 87, that's 78. 649, that's 946. 8537, that's 7358. Then the next one is this is a clock face. Please put in the hour markers and the time at 10 minutes to 11 o'clock. So you can do that. Please put an X in the triangle. You can do that. Which of the above figures is largest? You can take a shot at that answer, which is the square. I'm going to tell you a story. Please listen carefully, because afterwards I'm going to ask you some questions about it. Jill was a very successful stockbroker. She made a lot of money on the stock market. She then met Jack, a devastatingly handsome man. She married him and had 3 children. They lived in Chicago. She then stopped work and stayed at home to bring up her children. When they were teenagers, she went back to work. She and Jack lived happily ever after. So what was the female's name? Well, her name was Jill. What work did she do? She was a successful stockbroker. When did she go back to work? When they were teenagers. What state did she live in? She lived in Chicago, so that's in the state of Illinois. So a score of 27 to 30, that's normal. A score of for high school and less than high school, it's 25 to 30. So now we'll go to the case of the day, which is pregnancy and preeclampsia. So we have a 33-year-old Asian female with chief complaints of uterine contractions and a headache. So we'll learn about pregnancy and preeclampsia here in a minute. What is the definition? Well, pregnancy can be defined as the development of one or more offsprings, known as an embryo or fetus in the uterus of a woman. It's also commonly defined as the fertilization, the implantation, and development. Preeclampsia refers to the new onset of hypertension and either proteinuria or end organ damage, end organ dysfunction after 20 weeks of gestation in a previously normotensive woman. The key words are development, fertilization, and implantation. The key words are fertilization, implantation, development of one or more offspring, known as the embryo or fetus in the uterus of a woman. For preeclampsia, the key words are new onset hypertension, proteinuria or end organ damage after 20 weeks of gestation in a previously normotensive woman. Some things that you have to know, some spectrum of disorders that you have to know include preeclampsia. We already talked about that. Eclampsia is the development of grand mal seizures in a woman without any other neurologic conditions that could account for this seizure. The HELP syndrome stands for hemolysis, elevated liver enzymes, and low platelets. And it represents a severe form of preeclampsia, but it's controversial. Chronic persistent hypertension is defined as systolic pressure more than 140 mmHg and diastolic pressure more than 90 mmHg that antedates the pregnancy or is present before the 20th week of pregnancy. That's a key word, 20th week of pregnancy, on at least 2 occasions, or persists longer than 12 weeks postpartum. Preeclampsia superimposed upon chronic or pre-existing hypertension is defined by the new onset of either proteinuria or end organ dysfunction after 20 weeks of gestation in a woman with chronic or pre-existing hypertension. Gestational hypertension, this is hypertension without proteinuria or other signs and symptoms of preeclampsia that develops after 20 weeks. So that's the cutoff. Should resolve by 12 weeks postpartum. And if persisting beyond 12 weeks postpartum, the diagnosis is revised to chronic or pre-existing hypertension marked by the physiologic decrease in blood pressure that occurs in early pregnancy. If it resolves postpartum, then the diagnosis is revised to transient hypertension of pregnancy. So what are the numbers? Well, for pregnancy, it's 12.6 per 1,000 of the population. For preeclampsia, it's 4.6%, with a 95% confidence interval of 2.7 to 8.2%. So we'll talk about the risk factors. What are the risk factors of of pregnancy were being female, having a uterus, for preeclampsia, maternal age, race, family history of preeclampsia, previous history of preeclampsia, having a hydratiform mole, obesity, thrombophilia, oocyte donation or donor insemination, urinary tract infection, diabetes, collagen vascular disease are just a few risk factors. In terms of causes, well, sexual intercourse and assisted reproduction. For hydratiform mole, it's maternal and or fetal and or placental factors. Also abnormalities in the development of the placental vasculature early in pregnancy, weeks to months before development of clinical manifestations of the disease, placental underperfusion and possibly hypoxia and ischemia. The differential diagnosis for pregnancy could be anything from a cervical lesion to pseudocyesis, where the woman has the symptoms of pregnancy but is found by the physician not to have any signs of pregnancy. For preeclampsia, the differential diagnosis range anywhere from chronic hypertension to thrombocytopenic purpura. For the signs, for the symptoms and the signs, the clinical presentation, the symptoms of pregnancy include anything from nausea and vomiting to changes in the breast. The breast becomes enlarged and tender. There's increased frequency of urination, and then also for preeclampsia, the signs include a severe headache, visual abnormalities, scotomatars, and then also hypertension, which is measured during the clinic visit, as a systolic blood pressure of more than 160 mm mercury and a diastolic more than 110 mm mercury on 2 occasions, at least 4 hours apart or only once if treated. What are the laboratory orders that are needed in diagnosis? Complete blood count with differential is needed, a basic metabolic panel, blood type, antibody screen. I have the panel of laboratory orders listed, all the way to hepatitis C antibody. For preeclampsia, the laboratory orders include a complete blood count, a comprehensive metabolic panel, a 24-hour urine collection for protein and creatinine, and then serum creatinine level, serum uric acid level. So those are the laboratory orders. In terms of imaging for pregnancy, and imaging, the imaging that is required includes an ultrasound, and then for preeclampsia, the imaging required is also an ultrasound. Procedures includes a cardiotography, which is basically a fetal non-stress test, and also delivery, which is the definitive therapy, and that's the same thing for preeclampsia. For medications, for pregnancy, a prenatal vitamin, folic acid 0.4 milligram, iron sulfate 325 milligram, 3 times a day, colace 100 milligram, high calorie diets and high fiber diets. For preeclampsia, the medications include the basic principles of airway, breathing and circulation. So you have oxygen, intravenous access, cardiac monitoring, magnesium sulfate. This is a first line medication for preeclampsia to prevent seizures. It's given as a 4 gram bolus, and the details are listed. Then hydralazine, I have a did you know point here, which I used to put on my collaboration portals in residency. in collaboration with various organizations. Hydralazine was the first medication that was used for hypertension in pregnancy, and is given as a dose of 5 to 10 milligram, with the details listed. Labetalol, hydralazine is a vasodilator. Labetalol is a non-selective alpha and beta blocker. It's given as a dose of 20 milligram, in subsequent doses as 40, 80 milligrams up to 300 milligrams. Nifedipine, that's a calcium channel blocker. It's given as a dose of 10 milligram orally up to total dose of 3 doses. Sodium nitroprusside, that's a vasodilator. That's given as 0.25 to 0.3 mcg per kg per minute as an IV infusion. It's important to ensure that the patient is well hydrated, and also measure her hydration status if necessary with central venous or pulmonary artery pressure monitoring. It should be 5 mm mercury. Total fluids should be limited to 80 ml per hour, or 1 ml per kg per hour. Dexamethasone is given as a 10 milligram IV every 6 to 12 hours, and followed by 5 milligram every 6 to 12 hours, and also continued postpartum for patients who have persistent thrombocytopenia. Low dose aspirin is also given. It's given as 60 to 150 milligram per day in women with risk factors for preeclampsia. So that actually counts as a preventative measure. In terms of consults, who do you consult in both pregnancy and pre-eclampsia? Well, a family physician, a midwife, a pediatrician, and then in terms of preeclampsia, a nephrologist, a neurologist is also needed too. Prevention for pregnancy is contraception, and abstinence and there are so many contraceptive modalities in healthcare, and abstinence is also another form of contraception. For preeclampsia, aspirin has been under research recently, and that's also a preventative modality. So now we'll go to the Powerball question. This is your chance to win points to get accreditation Council of Graduate Medical Education CAL competency with this company, this collaborative institution. And for pregnancy, the Powerball question is the birth rate is 12.6 per 1,000 population, true or false? Well, if you answered true, well, that's the answer. But you can still take a shot at it. Send me the answers and get a chance to win prizes. For preeclampsia, the Powerball question is preeclampsia has an epidemiology of 4.6%, which is 95% confidence interval, 2.7 to 8.2 of pregnancies worldwide, true or false? Well, that's true. So the references are listed. I want to thank the author of this article for the knowledge that was used to develop this text, with the main idea of pregnancy and pre-eclampsia, with the evidence ranging from the various sections of pregnancy and pre-eclampsia, the analysis from the definition to the Powerball question, the links of the references. And I would like to state that my National Residency Matching Program interview process for 2010 was an Accreditation Council of Graduate Medical Education CAL competency certification, with an observership as a premier gravida at Huntsville Family Medicine Residency Program, Huntsville, Alabama, with a fast-paced collaborative team with a schedule of 6 a.m. to 6 p.m. with medical knowledge, patient care, practice-based learning and improvement, system-based practice, communication and interpersonal skills and professionalism, and interviews with various graduate medical education programs nationwide, and eventually matched at Southern Illinois University Family Medicine Residency Program, Springfield, Illinois, and my Accreditation Council of Graduate Medical Education CAL competency in obstetrics and gynecology, improving through medical school, through graduate medical education at Henry Ford Internal Medicine Residency Program and Southern Illinois University Family Medicine Residency Program, Springfield, Illinois. under supervision and subsequently independently, and I became proficient and certified in deliveries. It is common to get the number of deliveries to get certified within 1 month on the busy labor wards of Atlanta Medical Center, Crawford Long Hospital, and Southern Illinois University Family Medicine Residency Program, Springfield, Illinois. And I'm grateful to the expert program director, the faculty, residents, and staff, and would recommend these graduate medical education programs to anyone looking for the perfect fit for their graduate medical education goals. And if you participated in this activity, you just earn points in ACGME core competencies, and you can contact me to be able to get certification. So now we'll go to the next section, which is graduate medical education curriculum review. We have a 44-year-old Asian male who presented to the emergency department with chief complaints of loss of consciousness. So I want to encourage you to review the advanced cardiac life support algorithm. Endpoints, contact me for your certification. And also we'll go to the next point, which is the graduate medical education collaboration. And I have the updated collaboration information, which I'm going to send out via various collaboration modalities with the recent up-to-date number on the interview session, what programs are still interviewing, what programs have finished interviewing, and what programs and you know, to be able to guide you through the interview process. And then also we'll go to the next section of the show, and and that's, you know, talking about my curriculum development with my alma mater, American International School of Medicine, Guyana, various graduate medical education programs, and also organizations, and Watermark Clinic, Dallas, Texas. I want to invite you to join our fellow resident medical students and collaboration programs with certification and scholarship opportunities, and also welcome our new group of collaborators with information found on our collaboration modalities. So we'll go to the next section, which is from the White House and healthcare news. And I want to talk about middle class economics by the President of the United States of America, President Barack Obama, with main points structured on middle class economics, the evidence of the synopsis of the various sectors in the United States and globally, analysis of the various updates in the economy, and links of the economics in various sectors of the United States economy, which can be found in the various issues, the initiatives, and also the various presidential offices. In the practical, from the weekly address by the President of the United States of America, President Barack Obama, on the 31st of January 2015, titled A Path Towards a Thriving Middle Class, with the main idea of choices in economic growth, analysis of the quintessentials of execution, evidence of the recent advances with the Obama administration, Congress, and other bureaucratic partisans contributing towards economic growth. Links which can be found on the White House website on the various issues, initiatives, and presidential offices. And I want to thank Duke University and the University of North Carolina at Chapel Hill and Capella University for the knowledge from the articles on the meal plan and the reverse outline plan appropriately cited. So now we'll go to healthcare news. Healthcare is a dynamic field with lots of opportunities for healthcare and not healthcare professionals. From the American College of Physicians, it's all about internal medicine jobs, career opportunities. From the American Academy of Family Physicians, the AAFP Career Link is slated to take place on Tuesday, March 3rd at 3 p.m. to 5 p.m. and you can contact the American Academy of Family Physicians physicians for that information. The AAFP and CDC have resources to help you talk with your patients to limit the spread of measles. From the American Psychiatric Association, there's emerging research suggesting that an ADHD drug may reduce binge eating. From the American Academy of Pediatrics, behavior and emotional problems are common in U.S. children, not always identified properly. They have a new clinical report that offers guidance to doctors in screening children. You can check that out by clicking on that link on the collaboration modality, or contact me for more information on this. From the American Academy of Pediatrics, there's talk about from the American Academy of Pediatrics. I hope you enjoyed the webinar on Too Small to Fail that took place on the 28th of January, talking about why you should start talking and reading and singing to your child. We do that all the time on Dr. Chiquito Mentoring Iridescence educational global collaborative YouTube show, a Reach Higher and Let's Move initiative of the First Lady of the United States of America, First Lady Michelle Obama. We actually had last year we actually had a reading with my then 2-year-plus son, Kingston Eke, and we had a reading. He was in a chair, and we read, and then after that, and it was a collaborative environment, and I also incorporate that into any developmental learning with supervised visitation with various professionals. So from the American Congress of Obstetrics and Gynecologists, there's talk about the diet in pregnancy, talking about the current guidelines for fish consumption. So this is a very interesting interesting captioned article that I would recommend as a good read for those who are interested in women's health. From the American Board of Family Medicine, there is a question of the week: which one of the following tumors is most likely to cause hormonally induced hypocalcemia? And the answer to that is squamous cell carcinoma of the lung. From the NRMP Twitter chat, the National Residency Matching Program. I hope you enjoyed that Twitter chat. I was able to collaborate with them via our collaboration modalities. The main topics were on the competitiveness of the various specialties, the various programs, about the SOAP program, about SOAP eligibility, also the interview process, pre-match, which some people may have taken advantage of, the deadline to withdraw from the match, which is February 25th by 9 p.m. Eastern Time. And then, and also the confidential nature of the rank order list, the program director survey under the match data, the opportunity to contact the help desk of National Residency Matching Program by calling their toll-free number, which is 202-400-2233. The various specialties available, with an emphasis on the status of your application, which can be active, ranking, or certified. I will also want you to check out on our collaboration modalities, updates from the Global Health Conference that was done last week at University of Texas Southwestern University, with lots of multi-specialty teams with various topics which are actually very congruent to healthcare, with our new team of collaborators on this show. Also from the American Academy of Pediatrics, the President Sandra G. Hassink, MD, urges parents to vaccinate their children against measles. From the American College of Physicians, it's about internal medicine jobs. From the American Academy of Family Physicians, in 2014, they there were 644 confirmed cases of measles, the greatest number in 1 year since the elimination of the disease in the US in 2000. An additional 84 cases of measles were reported across 14 states between January 1, 2015 and January 28, 2015, related largely to an outbreak originating at Disneyland. Talk to your patients about getting vaccinated. Very useful information about measles for healthcare. From the American Academy from the American Psychiatric Association, there's the Psych News Alert. Drug targeting NMDA receptor rapidly improves depression symptoms in phase 2 study. Very important information about depression, which is seen in healthcare, and which we have opportunities and information for. From the American Congress of Obstetrics and Gynecologists, exposure to common chemicals may be linked to an earlier start of menopause. So this is also about women's health. The question of the week, which from the American Board of Family Medicine, which one of the following is most consistent with the diagnosis of asthma? In asthma, which is an obstructive lung disease, which is quite common, there's a reduced FEV1 and a decreased FEV1 FVC ratio. So that's option number A. If you pick that option, you can get points with the ABFM and also with us by collaborating with us. From Capella University, it's official. Groundhog Boxsutamni Phil saw his shadow. So there are 6 more weeks of winter, and now is the time to prepare for spring. It's time to explore your degree opportunities for spring. From the American International School of Medicine, Guyana, the AISM Times has up-to-date information for you, and also nutrition information on the health benefits of cabbage. From the Reach Higher initiative, there's information on the collaboration portal of Happy National School Counseling Week from the First Lady of the United States of America, First Lady Michelle Obama. And I'll take a few minutes I'll take a few minutes, and this collaboration will be back in a few minutes. So I apologize for that interruption in collaboration. Dr. Chiquito Mentoring Iridescence Educational Ustream YouTube show, and we're back live on this show. We're going to be talking about healthcare in Spanish. So we'll talk about nausea and vomiting. Nausea, that's nausea y vomitos. Nausea, nauseous. Do you feel nauseated? Se siente nauseous? Do you feel sick to your stomach? Se siente enfermo del estómago? Vomiting, vomitos. Did you vomit? Sabía usted vomitar? Did you throw up? Sabía usted vomitar? If you notice, these are synonyms. mean the same thing in Spanish, though they are quite different in English. What color was the vomit? So, de qué color era el vómito? Did you see any blood in it? Have visto alguna sangre en ella? And that's nausea and vomiting. We've talked about pregnancy and preeclampsia, nausea and vomiting, which can both be a double whammy, a chicken and egg situation in fast-paced collaborative situations in healthcare especially. So now we'll collaborate with the Office of the First Lady of the United States of America, First Lady Michelle Obama, and I will read a letter from the First Lady of the United States of America, First Lady Michelle Obama. Dear Dr. Ugoji, I want to thank you for taking the time to write to me in the White House. It means so much to me to receive warm wishes like yours, and I hope you know how much I appreciate your thoughtfulness. Over the past few years, I have had the extraordinary privilege of receiving letters from people living across our country and around the world. I have seen and heard firsthand the very best of the American spirit, and my family has experienced incredible kindness and warmth. The President and I share your hope and optimism for our shared future, and with that conviction, I encourage you to find new ways to improve your community so we can ensure an even better future for our children. I wish you all the best, and again, thank you for writing. Sincerely, Michelle Obama, First Lady of the United States of America. So that's the letter from the First Lady of the United States of America, First Lady Michelle Obama. And I'll read my reply to this letter. A 3-year-old African-American male contributing towards healthcare with various organizations and the Star Wars campaign of the American Academy of Family Physicians and structured curriculum of early developmental learning. The medical student with medical education for graduate medical education and Accreditation Council of Graduate Medical Education core competencies reinforce my desire to cultivate the American spirit, kindness, warmth, hopes, and optimism for a shared future, symbolized by dynamic global leadership of the Office of the First Lady of the United States of America, FLOTUS, with the Reach Higher and Let's Move initiative, with numerous educational opportunities and healthier global communities, from a microcosm to a macrocosm level in educational institutions, healthcare, and other sectors, and optimism in graduate medical education. As a single mother graduate medical educator in a divorced child custody, as a team of professionals to emerge with the prerogative with unsupervised supervision of that 3-year-old who is my son, Kingston Eke. After 2 years of sole custodianship, and create a secure parenting environment as an adult, emotionally stable, without any public displays of emotions in court and unverified, falsified documentation pending proof up by the other parent, and optimistic for child support exemptions and sole custodianship for domestic violence, fair hearing with awareness created on domestic violence, formal documentation of intent not to press charges with legal professionals, and no further damaging statements to uninvolved individuals in a closed case liable to civil charges amidst fluctuations of life, which everyone is exposed to as part of a public health project incorporating the United States government, the Reach Higher and Let's Move initiative, with a commitment to public service, demonstrated leadership in the community, and a commitment to the mission of the Obama administration. I am optimistic that I will be able to incorporate these skills acquired by collaboration with the Obama administration and the various presidential offices in my career, and completed application for the White House internship and extend an invitation for collaboration with the Office of the First Lady of the United States of America, FLOTUS, the First Family, and the Obama administration, with Dr. Chiquito mentoring Iridescent's Educational Global Collaborative Ustream YouTube show, a Reach Higher and Let's Move initiative of the First Lady of the United States of America, First Lady Michelle Obama, dedicated to creating healthier and safer communities in the global economy. Thanks and have a wonderful day. Dr. Chinyere A. Ugoji, MD, MBA. So I want to thank all professionals in various fields, healthcare, legal and public health, and victims who have worked with me in putting faces to child abuse, sexual abuse, domestic violence as a public health continuum with the various knowledge gained from civil cases to intent to press charges. All these are legal terms which I want to thank the professionals and also the authors of the articles. So now we'll go to the next section of the show, which is the graduate medical education, the distinctive graduate medical education forum. And we have a real life graduate medical education case study. And a resident or fellow in a graduate medical education program sent a faculty member a text which said, "I wish, how does this fit into Accreditation Council of Graduate Medical Education core competency?" Well, professionalism includes ethics, cultural competency, and other components. And apologizing, explaining the factors behind this case scenario, which I have incorporated in my Accreditation Council of Graduate Medical Education core competencies. Imagine proficient in graduate medical education core competency certification, and I hope that I can be able to serve as a learning opportunity for other graduate medical educators and also those who are interested in graduate medical education to transfer this knowledge. So I want to invite you to share your personal experiences while this is an opportunity for us to share our personal experiences. So we're going to talk about some more interesting stuff on this show. We'll talk about what are the top 3 reasons why you may not have gotten an interview yet. The ranking process, what factors to consider, opposed or unopposed, university or community, externship, observership opportunities, and fellowship opportunities. We'll talk about the affordable health care from a graduate medical education, from graduate medical education perspective. We'll talk about collaboration opportunities with this show and this company, with various individuals and opportunities in medical, student, resident, fellowship, White House intern, Reach Higher, and Let's Move initiative collaborators. You can share your pictures, share your experiences, call me, send me an email with your stories. I take time to read your posts on various collaborative modalities. I take time to read them and to reach out, just like various other experienced graduate medical collaborators. I'm going to also bring you, we also have a graduate medical education tour for the last 3 weeks before the rank order list deadline. I also want you to fill out my survey. I'm going to be posting a survey on getting to know you. I'm getting to know about your medical knowledge, your USMLE scores, your patient care, your practice-based learning, your system-based practice, communication and interpersonal skills, um, um, professionalism, which includes the interaction with various members of the society, various members of the healthcare field, um, which may include your family. I have physicians, I have other healthcare workers in my family. I know lots of people who also do have healthcare workers or physicians in their family. Your interaction with them, your interaction with the public, with the society. So I'm gonna send out that survey, and you can be able to fill that out and be able to put your voice to this graduate medical education collaboration. We'll talk about my pediatric project with the Reach Higher and Let's Move initiative and the Star Wars campaign. With the updated curriculum, we have actually added alphabets, colors, and sentences with energy and environment, trains and motor cars. So that's very interesting addition for that titled events. Also movie events. And I want to end by saying that all names and information listed in this show constitutes probable fictional depiction with a need for documentation collaboration. And it's approximately 7:55 a.m. and I would like to end the show. Request a formal interview with graduate medical education and programs nationwide through the Electronic Residency Application Service National Residency Matching Program 2015, and I'm willing to travel and also to be able to collaborate with you on my graduate medical education goals. And wish you a wonderful interview day and a wonderful day.